Hi doctors, how are you? Now we will talk about anteriolateral MI by Dr. Muhammad al-Baydani. After we talk about right coronary artery, there is left coronary artery. This is left main stem, divided into circumflex artery which supply the lateral wall, and also divided into anterior descending artery which supply the anterior wall of the left ventricle. So left main stem, circumflex artery and anterior septal. كل احنا نعرف انه anterior septal of the heart readed by V1, V2, V3 and V5 lateral wall by lead 1, AVL, V5, V6. Okay, so ECG change either ischemic or non-ischemic. Okay, both of them associated with positive serum troponin. Okay, V1 to V5. Okay, there is ST segment elevation. Okay, or non-ischemic ST segment depression or T wave inversion, but with positive serum troponin. Okay. Anterior septal MI can be isolated, okay, or with other wall infarction. Maybe there is inferior infarction and anterior septal infarction. Okay. Great. Severe anterior extensive MI. إذا كانت ال MI بالanterior wall extensive, sometimes reach to the AV node and cause damage of the AV node, lead to permanent permanent heart block. يعني مرات الاكستنسيف MI بالanterior wall of the heart بتكون massive. فتأثر لي على ال AV node. The AV node will be blocked. And this block need permanent pacemaker, because when the anterior septal MI associated with heart block mean massive MI, there is extensive damage of the cardiac muscle, so need permanent pacemaker. يعني إذا anterior wall of the heart إجا ويا heart block، يعني الانفاركشن كلش كبير، بحيث من قد ما هو كبير واصل إلى لل AV node، لذلك يحتاج permanent pacemaker. ECG change, you see in this ECG there is ST segment elevation in the V1, V2, V3, V4. Okay, this is anteroseptal MI. This is also reciprocal change in the inferior lead, AVF, lead 3, and mild in the lead 2. الريسبروكال الميرور، يعني الكهربائية تتجه باتجاه الانتيروسبتال فتكون ST segment elevation. while تبتعد عن الانفيريور وول، لذلك يكون بها depression. هذا ال ST segment depression يسمونه reciprocal، يأكد لي elevation. This is also ST segment elevation, lead 2, lead 3, lead 4 and 5. This is anteroseptal MI. I talk about just anteroseptal MI. This ECG show large extensive anteroseptal MI. There is ST segment elevation in V2, V3, V4. This pattern of ST segment elevation called tombstone pattern. شنو tombstone pattern؟ يعني he will die. The patient as simple, he will die because the MI is very, very extensive. Lateral wall MI, there is occlusion in the left circumflex artery. Lateral area readed by lead 2, AVL, V5, V6. So lateral wall MI shows STEMI or non-STEMI change in the lateral lead, as symbol, because occlusion of the left circumflex artery. Lateral wall unlikely come isolated، يعني ما تجي وحدها عادة أو always. come with the anterior MI. So it's called anterolateral MI. Occlusion in the main stem or bifurcation of the left coronary artery causes anterioseptal MI. Anterioseptal MI manifested by a change in the V1, V2, V3, V4, V5, V6. Lead 1, AVL, يعني anterior lead, anteroseptal lead and lateral lead, and the occlusion in the left main stem. This is rarely infarction just in the lateral wall. There is ST segment elevation in the lead 1, okay, and V5 V6, okay. This is lateral wall infarction. Okay, هسه جاي احكي just about the lateral wall. There is also inferior wall, okay. هذا مو موضوعنا. عندنا lateral wall infarction. قلنا anterior MI lateral MI usually come together, okay. Anteroseptal MI because the occlusion in the left main stem. So there is change in the V1 to V6 and lateral lead 1 and AVL. So there is ST segment elevation lead 1, lead 2, lead 3, okay, lead 4, okay, lateral lead 1 ST segment elevation, AVL ST segment elevation, V6 ST segment elevation. So this is occlusion, thrombosis in the left main stem manifested by anteroseptal with lateral wall infarction. Okay. Management, okay, as simple. Aspirin 300 ملغ 3 حبايات، بلافكس 400 إلى 600 6 حبايات إلى 8 حبايات، هيبارين 1 سي سي، انجسيد حباية جو اللسان، انالجيزيا مورفين، إذا ماكو ترامال وبلاسيد، إذا كان تاكيكارد أقدر أعطيه ميتابرولول وأنزل الريت ل 65 60 وأدزه للبي سي آي.